Hello, are you living with symptoms that bother you a lot, that have been around for many years, and they seem to be unexplained by the doctors who you seek care from? The labs don't tell you why you're suffering. The imaging studies perhaps don't tell you why you're suffering. The doctor is left clueless and doesn't know really what to do to help you. If you're somebody like that, stay tuned for this quick video. We're going to show you some highlights of an incredible video testimonial that this patient gave me. My name is Dr. Lonnie Herman. I'm the creator of the Rapid Health Restoration System. And when you watch this video, you're going to see some incredible and hear some incredible changes that this man experienced from my care and my care alone. So let's flip to that video and I'll be back in just a moment. How much better would you say with all these symptoms? If you can give a percentage of how much improvement you've experienced from this work with me.
With some of the symptoms that I'll describe in a minute, 100%, and other symptoms around neuropathy in the feet, 90%. Anytime my body was exerting and trying to perspire, the only way I can describe it best is it felt like I was having electric shocks, in various, like streaming through my face, cheeks, and things of that nature.
That's pretty scary.
It was very uncomfortable. Yes, I had to sometimes lie down and put ice, on my legs or whatever, just in order to, try to cool my body and to minimize the symptoms that I described. When I was getting the results back from the neurologist, those came back inconclusive as far as what was really the source of that.
Hands and feet feeling asleep, was that constant 24 hours a day, 7 days a week?
It would happen when I was starting to do some physical activity.
Walking physical activity, driving physical activity?
Walking,
anything.
Bike riding. I was having more of the traditional neuropathy in the feet. For example, you put your shoes on and, your feet start to feel numb and uncomfortable.
Simulating the type of stress environment that made the symptom come on for the person. And we used with you the heat experience. We were able to trigger that exact response that the heat was actually, and find why, right? Find why that was happening to you, why the heat actually drove those symptoms to occur.
You have many video testimonials, and that certainly is one, I think, proof source to say it's not just one video, it is a range of individuals with a range of symptoms. People are going to, medical, experts, and they are not getting relief. And that was me. That was my journey as well. There's a different starting point, a different philosophy. You go and take a pill, which I was very aware of what they could do, what they might prescribe from a Western medicine. And Western medicine, and then the pharmaceuticals certainly have a place. It's when they're not actually getting to the root cause that is problematic. And that's what you did. You were, while the symptoms were important for you to know and to address, it was more understanding, well, why is that the case? What's happening inside of somebody's body that's causing these symptoms? And that's really the benefit of the kind of work that you do that I had experienced firsthand.
It's my pleasure that you're better. I love it. And it's, it's something that helps me to be driven to do good work for people and great work for people and help people get their lives back. So I appreciate you coming on this call, and we're going to show this to the world. And thank you so much.
Thank you. Appreciate the work you do.
Isn't it just incredible? The relief that he experienced from this care is just phenomenal. I want to take a moment and share with you, a few moments actually, and share with you the exam findings, what I helped to create a unique healing protocol for him to get rid of the infections and the toxins that were in the brain and other parts of the body that made him feel these unexplained symptoms. Now they were explained, obviously, from the work that I do. We're gonna hear this first, a presentation about what the exam findings were that I treated him for, and then I'm gonna make you a unique offer, a free offer, and then we'll be able to help you get an appointment here for when you're ready, okay? So first, I found with him that in the brain there was some arsenic heavy metal. I found chlorine, fluoride, mercury, lead, and other heavy metals affecting his brain. I found with a unique system, and this is not through urine testing or hair testing for heavy metal testing. We actually know where the heavy metals exist in the body with this unique method that I utilize in my clinic. I also found that the lymphatic system was loaded with mercury. I found also that a part of the brain that helps to control the liver, it helps to control the pancreas, helps to control the kidneys. It helps to control all hormones of the body. There's a particular part of the brain called the hypothalamus. And the hypothalamus regulates blood pressure. It regulates blood vessel size in part. It regulates blood vessel size. It also helps to regulate these organs and all the hormones of the entire body. And even the adrenal glands too. The hypothalamus had multiple different heavy metals, including arsenic, including lead as well. I found also that the islet cells in his pancreas, the islet cells are the cells that make 3 hormones. One of them is insulin. Another one is called glucagon. And another hormone that helps regulate your blood sugar, by the way, is called somatostatin. The islet cells also had a certain bacteria called Enterococcus faecium bacteria. I found the brain also infected with the Enterococcus bacteria. I found his vagus nerve infected with the parainfluenza virus. I found a part of the brain that's called the thalamus, which helps to regulate sensory and motor for the whole body, meaning making your muscles work and making you feel in your body all the normal sensations. The thalamus had thimerosal, which is a very dangerous mercury that probably has been there for many years. Let's just say there are certain things that can be put into the body. I won't use the particular words there, but certain things that can be put into the body by another practitioner where there's this dangerous toxic heavy metal that's involved in that, and it can seep into parts of the brain and the body. I also found that he had the influenza virus in parts of his body. His incredible recovery is proof that healing can happen when all other doctors can't figure it out for you. All right, and this system is very unique and very effective to help people find the different infections and toxins that cause the symptoms in their body. And we can find the different infections and toxins that exist in the body that cause the different diseases of the body. So that can be done for you with this rapid health restoration system that I've created over years. The fact is, according to neurology studies and immunology studies, it's deeply embedded in infections and toxins that get into our tissues of the brain and the body that make symptoms occur. So we can find those and get rid of them in a safe and effective manner using frequency-based quantum energized formulas. The frequencies meet the frequency of the infection or the toxin and get it out of the body. It's that simple to understand. Okay? Every person who's suffering from various symptoms needs to understand that, because you could have 2 people in the room who have the same symptoms and the same diagnosis, but they're caused by different pieces of the puzzle, so to speak, that makes person A suffer from the same symptoms as person B, but they have different causes in their body. So we're looking for those unique causes that are cause your problem as well as the next person. Okay, and we have to find with safe and effective methods to get them out of the body, to get those infections and toxins out so you can restore your health. And that can be done. Understand, to liberate you from your disease, from your symptoms, you have different pieces of the puzzle that have to be put together. It might take you only a month to put a puzzle together. Maybe it takes 2 months or 3 months, or maybe 2 or 3 treatments to put the puzzle together. But once we can do that and we see the restoration of your health, then we know that we've accomplished what we were set out to do together. Well, it's not just symptom relief, but even in lab studies, we can see positive changes that have occurred for patients, okay? So we're going to look at it from both sides here with my unique care that I'm offering you. There is a free offer here. You can download your free copy about how you can reverse chronic disease with the quantum formulas that we're using. So if you look here at the copy of the book here that I have up next to me, you just go to my website, drlonnieherman.com, and you can download your free copy of my ebook. And that's very simple to do. It's about 40 pages in length, and it's real simple to follow and read through. And there's a lot of research in there, but I put it in very simplistic terms to help you easily understand and read through that very quickly. Okay, some people told me it'd take them maybe an hour to read through. So that's free for you as well. The care that I offer to help you achieve the symptom relief, like what my patient here said, which you're going to see more of a video from him after I'm done speaking here, but this whole testimonial, the care that I'm providing you is not covered by insurance companies. That's not my fault. It's just doing the right thing for you. Insurance companies, they sometimes don't recognize services that are just not covered under your policy, and I have to do the right thing for you. Okay, so you can contact my clinic and find out about the investment in yourself. You can look at the frequently asked question page on my website and find out how much your investment is going to be to help you restore your health. All right, it's all about getting you better. Number 1, to make your appointment, you can contact my clinic at 954-370-3100. That's 954-370-3100. Or you can contact my clinic through email at clinic@drlonnieherman.com. That's clinic@drlonnieherman.com. I look forward to helping you restore your health, and I'll see you soon. Hi, welcome to another great patient testimonial that I'm here to share. My name is Dr. Lonnie Herman, and I'm with a great patient. His name is Chris, a patient of mine. His name is Chris, and he came to me with certain terrible neuropathy symptoms. I'll let him tell you more about it. And with our care, he is so much better, and you can too. So let's meet with Chris. Thank you for getting on this video recording today with me. I appreciate it. You originally came to me a few years ago because you had neuropathy in the hands and the feet and a few other symptoms that we'll highlight, or I'll let you tell the story, but that was the reason why you had come here originally. Yes.
That's correct. Yes.
Yeah. And just now at the point where we are now, your neuropathy that you came in with and the other pains that you're about to describe to people, how much better would you say with all these symptoms? If you can give a percentage of how much improvement you've experienced from this work with me.
With some of the symptoms that I'll describe in a minute, 100%, and other symptoms around neuropathy in the feet, 90%.
Okay, great. So if you could start out by telling us, how long ago did you notice you had neuropathy, and describe what the neuropathy was like for you?
What began as a feeling of my hands and feet being asleep, that tingling feeling you get sometimes in your body, that is what started, and that progressed after about 2 to 3 months into an experience where I got out in the sun, and immediately my stomach and my back, it felt like I was being electrocuted. It was a very painful experience. I didn't obviously know what was going on, why that was happening, and it was very uncomfortable. That continued to progress, and really what I started to figure out is that anytime my body was exerting and trying to perspire, I would get these very painful, what felt like electric shocks, as I mentioned. So, for example, even if I was eating something warm like an omelet or soup, I would feel it in my face. One time I was getting towels out of the dryer, and just the heat of the dryer and the warm towels made my body start to have this very painful electric shock. And what I deciphered was that my body was trying to perspire, but it wasn't. And I think, looking back, that was kind of what might have been going on. And so naturally, I wanted to get relief from that. And I saw, primary doctor. I went to the hospital once. So this progressed over a few months. And in addition to the hospital emergency room, I went to a neurologist, a couple of meetings just to find out. So they did some tests on large fiber, small fiber neuropathy, or not neuropathy. I can't remember exactly now the test, but they were doing certain tests. But when I was getting the results back from the neurologist, those came back inconclusive as far as what was really the source of that. So I was at the point where I had the opportunity to go to a more notable clinic in the U.S. to get more diagnoses, and that's kind of the point at which I found your clinic and started to see you.
Okay. And back to the symptom, when you felt you eat something warm like an omelet, you felt it in your face. What was the feeling in the face? The electric shock feeling, or was there some tingling, or how would you describe it?
Well, it was a painful burning. So I would feel it in my forehead, for example, and my cheeks. So it would be this intense. The only way I can describe it best is it felt like I was having electric shocks, in various, like, streaming through my face, cheeks, and things of that nature.
That's pretty scary.
It was very uncomfortable. Yes, I had to sometimes lie down and put ice, on my legs or whatever, just in order to, try to cool my body and to minimize the symptoms that I described.
How long after you ate a meal or you went outside in the heat, how long did those symptoms, when you started to feel those shock-like symptoms, how long did those last for if you didn't put ice or didn't try to just rest? Like how long, even with rest or ice, how long did that last for?
Well, when it would happen, it would be instantaneous. So if I walked outside, for example, in the sun, and then when I got back into a cooler environment, it would range depending on how my body was, had heat exerted on it, or had, under that pressure. So sometimes it would take a few minutes, sometimes it would take longer. Like I said, I would put ice on my legs or chest and lay down and just cool my body.
Could it be longer than a few minutes? I mean, longer.
Yes, it was.
An hour, a few hours.
No, it would never be like an hour long. It would usually subside maybe over 5 to 10 minutes, or less. But so in that kind of 2 to 5, 6 minute range on average, I guess.
And the feeling like your hands and feet were asleep, how long? I mean, was that a constant day and night symptom, or was that on and off for that period of time when you were experiencing that?
That was more initially as the first symptoms that I knew something was not right, which progressed into more of the intense feelings as I described. So, but then later on, I did have some. So at that time, I was getting the numbness, which progressed as I mentioned. Then, after that, after we kind of found the cure for that, which I know you'll describe on the video, then I was having more of the traditional neuropathy in the feet. For example, you put your shoes on and your feet start to feel numb and uncomfortable.
A feeling of hands and feet being asleep in the beginning before we first met, what brought you to my clinic, after other things that were offered to you, medicines and other tests failed to help you. Hands and feet feeling asleep, was that constant 24 hours a day, 7 days a week?
Oh no, that was episodic. So it would happen when I was starting to do some physical activity.
Got it. So walking physical activity, driving physical activity,
Walking,
anything.
bike riding.
Anything. But when you lay down at night after a full day of activities, work, whatever you were doing, did the numbness in the hands and feet, the feeling like they were asleep, the tingling, was that still there, just not as severe?
No, that would go away. It was episodic.
It would go away. Got it. Okay. I will go over the findings with your permission, the kind of things that I discovered in you that I like to inform people so that people can understand the difference of what we're offering as opposed to what's out there in regular medical care. What would you say to people who feel that it's either too good to be true? Chris is just 1 in a million. Dr. Herman was lucky to get him better with this neuropathy. They think that it may be a far stretch because they've suffered for so many years, even some people for decades, they've had neuropathy and their doctors are telling them that there's no hope and they've tried everything. What would you say to them?
Well, the first thing I would say, I think anyone interested will probably notice this right away. You have many video testimonials like myself. And that certainly is one, I think, proof source to say it's not just one video, it's not just me. Obviously, there's a range of individuals with a range of symptoms. That'd be the first thing. Secondly, I think it's a fair point because people are going to, medical, experts, and they are not getting relief. And that was me. That was my journey as well. And so, for those reasons, I think what is helpful for people to recognize is there's a different starting point, a different philosophy. You go and take a pill, which I was very aware of what they could do, what they might prescribe from a Western medicine. And Western medicine, and then the pharmaceuticals certainly have a place. It's when they're not actually getting to the root cause that is problematic. And that's what you did. You were, while the symptoms were important for you to know and to address, it was more understanding, well, why is that the case? What's happening inside of somebody's body that's causing these symptoms? And that's really the benefit of the kind of work that you do that I had experienced firsthand.
Yeah. I mean, it was even, I remember one of the exams, because I always talk about simulating the type of stress environment that made the symptom come on for the person. And we used with you the heat experience. We were able to trigger that exact response that the heat was actually, and find why, right? Find why that was happening to you, why the heat actually drove those symptoms to occur. So I really, it's my pleasure that you're better. I love it. And it's, it's something that helps me to be driven to do good work for people and great work for people and help people get their lives back. So I appreciate you coming on this call, and we're going to show this to the world. And thank you so much.
Thank you. Appreciate the work you do.